the site directors at Fern Valley Natural Health in Bellevue. We primarily see pediatrics, but we also see a lot of women's health as well, so we are a family practice. We're going to talk today about some acute conditions that may show up in primary care. So I chose these things to talk about because I find that these are things that sometimes are scary for doctors, especially new doctors when they see it, especially when they see it in kids. Sometimes you have the drama of the child being sick and agitated, maybe crying and fussy, and then the parents who are also kind of reactive or responsive to the way that the child is acting. Especially new parents. New parents are going to be really scared anytime that something happens that's outside of the realm of normal, especially that first time that they have a cold or the first time they have a fever. And even though you may have talked to them about all these things and prepared them for it, it's still going to be that first time that it happens that they're really concerned about that. And then sometimes as a newer practitioner, if you haven't seen some of these things, or depending on what your comfort is, sometimes that emotional response from the family can sometimes make you feel like, okay, am I thinking this through all the way? Where do I need to be concerned? At what point do I need to elevate the level of care that I'm providing? So we're going to talk about fever, respiratory distress, rashes, abdominal pain, and diarrhea. All right, so fever. So fever is a normal immune response. It's something that I really want people to be comfortable with. We should be really grateful for fever. It's such a wonderful opportunity for that body to try to heat up, to burn up whatever it is that's coming in, and to help clear it out. It's a great defense system and something that we really should embrace and be happy about being there instead of being afraid, like, oh my goodness, there's a fever, what's going on? Maybe this is a higher force and I need to be concerned about it. Let's embrace fever and think about that being a really great tool to helping people be better. So when we're talking about kids, a lot of times parents will get really worked up when they feel their kid. Like sometimes at night they'll feel them, or their kids have been running around and playing, and then they'll be like, oh, they have a fever. And it's very common that in the office they'll be like, oh, they feel really warm, especially as they're getting them undressed. They feel really warm. They must have a fever. And sometimes seem a little alarmed when you check their temperature, and it's a very normal temperature, not even close to being anything elevated. So it's really common for kids to feel warm if they've been playing hard, especially if they've been crying. Sometimes the kids will be really thrilled about being there and playing, and now all of a sudden they have to get undressed, you're messing with them, they don't want to be touched, and they might start to kind of cry or throw a fit or struggle a little bit, and they can kind of get worked up, sometimes not only warm, but seem flushed or even a little bit sweaty because they're uncomfortable with the situation. It's no more just playing and fun. Nursing, so breastfeeding babies, it's not uncommon to see a breastfeeding baby that as they're kind of taken off of the breast to have like the side of their face be super red and flushed and sweaty. Hair can also be wet and matted, and that they could feel really warm because they were just working really hard with nursing. And they were right up against mom, which is kind of like a little incubator, and mom with producing milk is also putting out heat. So there are reasons that they can feel warm that's not an elevation of their core temperature or true fever. Other things to think about is, are they overdressed? Sometimes kids will come in wearing multiple layers, especially as the weather shifts and changes, and you've got new parents and they're going to be like, they kind of come in and they can barely move and they've got lots of layers on, and they start to take the clothes off. Or you get the kiddo who's just like, I'm not taking my jacket off. Like they absolutely refuse to take their jacket off, and the whole time they're there, hood on, jacket on, everything on, and they're still playing really hard. You start to take everything off, that kid's going to look like they're a little bit overwhelmed. And then other things to think about are the warm weather. So sometimes just when it's a really hot day, sometimes those kids will feel a little bit more warm just being outside and playing or in that warm weather. So think about that when we're thinking about, is this really a fever? Why is this kiddo warm? And is there just a natural reason? And reassure the parents that this is normal, this is okay. They don't have a fever. It doesn't mean that they're starting to get sick. These are some other reasons that they can actually just feel a little bit warm. They have a lot of energy and they can put off a lot of heat. So when we're talking about a fever, a true fever is 100.4. So when you're talking to parents, sometimes you say something and they hear what you say, and sometimes they hear something a little bit different than what you say. So a lot of times I'll tell parents, if we get to 101, then we're out of fever. Because sometimes when I'm saying 100.4, they hear 104. And they're like, wait, what? It's not a fever until it's 104. It's like, no, 100.4. And sometimes when they're home and they're trying to measure and they're figuring it out, sometimes just saying 101 is an easier number to think about. Most fevers are caused by viruses. Viral fevers are usually self-limited. They usually last about 2 or 3 days. It's not uncommon to have a fever for about 2 or 3 days without any other symptoms. A lot of times that's a really good sign that there's a virus that's at play here. So you'll get the call from a parent like, my child has a fever, I don't know what else is going on, I'm worried, is this okay? And then you'll notice that sometimes after that 3rd day the fever breaks. It's also a common time that a rash will break out. So fevers also have a natural course to them. So fevers will tend to rise in the evening and then break in the morning. So it's also good for people to know that that's a normal pattern. It's really common for kids to seem fine during the day, and then it's bedtime and they go to bed and all of a sudden they seem like they're burning up, and we check a temperature and maybe it's 102. And parents maybe get a little bit worried or concerned, or they call the office and they want to schedule an appointment, and then the next morning the fever is gone, their temperature is normal, and they're like, oh, no, we don't need to come in, everything's fine, it's okay, we don't have a fever anymore, whatever it was gone. And then that night, the fever comes back, and they're like, what's going on? It's not that something's worse, and it's not that we missed something, it's just a natural course for fevers to do that. And so it's important to let people know that, especially if they come in and you see them during the day, maybe they have a low-grade temperature, it's good to let them know that, there's a chance that this could actually climb as the day goes on, and here's some things to look out for. It's just the natural course of what fevers do. Fevers typically are not going to go over 106. So people get really scared about temperature and about numbers. And everybody's going to have a little bit of a different comfort level with it. But the body is wise, right? As naturopaths we're taught, the body's wise, it knows what it's doing, it's making decisions appropriately. The temperature's not just going to go up into infinity until somebody stops it. It's going to stop at a certain point. So naturally, fevers are not going to go above 106. Now I know I'm saying that number, and probably half of you in this room are freaking out thinking I would never even ever see a temperature that high because there's no way I'd let it get there. But there are some kids that just get high fevers. And I've had several of them in my practice where it's like they get a temperature and boom, they're at 105. And they're at 105 and they burn hot for a few hours, and then they go to sleep and they crash hard, they wake up, that fever's broken, whatever it was, they've kicked it out of their system. And that's just what they do. And the parents initially are freaked out, right? Like, oh my gosh, this is too high, what do I need to do? Or they're too casual, like, it's all right, they're fine. But what you want to do is then you want to just let them know and reassure them. And we'll talk a little bit more about when to be concerned, what sort of things to do. So when we talk about brain damage, right, that's the thing that everybody's worried about. If the temperature gets too high, are we going to burn their brain and cause brain damage? And those are the things the parents are going to ask you as well. So technically that's not going to happen until we get to temperatures over 108. Instances where that would happen is if you leave a kid in a car on a hot day with the windows closed. Those are more the situations that you're going to see that happen. So the other thing that people worry about are fever seizures, febrile seizures. They're not super common, but I guarantee if you see children, you'll see them. So they happen in about 4% of children, and it's usually somewhere between that age of 1 and 5. And oftentimes by the age of 5, they usually outgrow them and they don't happen after that time. It's not necessarily that end point of the temperature. I think a lot of times people think like it has to be a high temperature, like, oh, if they get to 104, they might have a seizure. I would say the majority of kids that I've seen that have had febrile seizures, they usually have them around 102. So I know it's like, okay, wait a minute, 102 in a kid, it's actually okay, how can that happen? It's that rapid rise. So it's the nervous system responding to that rapid rise in temperature as opposed to what that temperature is itself at its end point. And I want to make sure that you reassure people that it does not mean that they have an increased risk of developing a seizure disorder. A lot of times parents see these, they get really scared. It's a very scary thing to see. Kids most of the time have no recollection of what happened after the seizure. They're sometimes quiet and then they wake up and then they burst into a cry. Like they feel weird in their bodies, something just happened. And so parents can get pretty scared and then worry like, oh, are they going to have a seizure every time now? Are they going to have seizures later in their life? And it's really isolated to that event of their temperature rising. Now, it may be that every time that that kiddo gets a fever or has a rapid rise in a temperature, that they get a febrile seizure. But there's also some things that you could do at the onset of a temperature or when you think that they're sick and a fever may be associated to help with supporting their body so that we don't go into that seizure. One of the other things that can happen, and I've seen this happen a few times, is when kids have a high fever, and I usually see this around 104, one of the ways that the body will try to dispel heat and reduce that fever is through vomiting. So be prepared. You're in the office and you've got a kiddo that has 104 fever. Just know in the back of your mind, there's a chance that this kid could throw up. And I want to think about, where are they? Where's my garbage can? What else do I need to be mindful of? Because the first time this happened to me, the whole room got it, because he was up on the table, he lunged forward with his head out, and it went everywhere, which made for an interesting rest of my day. But what happens is the temperature quickly goes down, and it's just a natural mechanism that the body has to try to dispel heat. It's also really common, kids tolerate fever so much differently than you and I would, right? You and I are sitting at like 102, 103. We're dying, right? We're like, I can't get up, I can't lift my head, I can't function, I can't think. I cannot tell you the number of times I have kids bouncing around my office, playing, totally fine. Parents think they're fine, everything's great. We check their temperature, and it's like, oh, you're at 103.5. And the parents are like, what? And they seem fine. What's going on? A lot of times it ends up being an ear infection. But it's something that's really common. Kids can tolerate those higher temperatures. They're so much more vital. You and I would be wiped out. Okay, a couple other things to think about. So remember, we talked about fever is a natural response of the immune system. It's something that our body is going to use as a defense mechanism for whatever's gotten in there. So a lot of people like to use Tylenol or ibuprofen to try to suppress the fever because they're afraid of the fever is high. If they go to urgent care, a lot of times the recommendation will be hydration, which is super important, we'll talk about in a minute, and they'll give them Tylenol or something to help reduce that fever. Or it's just something that they know about or have heard about or talked to other family or other friends, and so they will do that. So what I want you to know is that if you give those things, it's probably only going to drop that temperature by about 2 to 3 degrees. The reason I mention that is because I think that sometimes parents give those things and expect the fever is just going to be gone, right? So it's important that if you're at 104 and then they gave it and then it's 102, they're going to be worried. Like, wait a minute, they still have a fever. It's still kind of high. This didn't really work. What's going on? Well, it did its job. It's just that its job is not necessarily to fully take that fever away. So sometimes you're only going to get a small reduction in that. The other thing that's really important, and I'll talk to families about, especially because fevers tend to be highest in the evening, which is when everybody wants to go to bed and sleep, is that if they give a medication to suppress that fever, when that medication wears off, 4 hours later, if the body wants the temperature to be that high because it's fighting something, they can actually have a rebound rise in that temperature.
Will that cause that increased rise in temperature, febrile seizure?
It can in kids who are prone to that. So the question was, can that rapid rise cause a febrile seizure? And so in kids who are prone to that, yes, it can. In kids who don't have a history of that, who have had fevers before, not necessarily. But what can happen is that parents are scared. Now they're not sleeping and they're hovering over their child all night, or they're watching at that sort of 4-hour mark of whether or not, their kid's going to be okay, checking their temperature, waking their kid up because I got to check your temperature, which the best thing for that kiddo is to sleep, right? So what you'll see commonly recommended in the conventional community is to overlap treatment. So what they'll do is they will do Tylenol as well as ibuprofen. And so they're just giving one or the other every 4 hours. So they're overlapped. So every 2 hours, there's something on board, but it's a different agent that they're doing. And then that's a way to maintain that fever through the night so that then you get to the morning when parents are awake, more watchful of their kiddo, they are able to sleep through the night a little bit better. And this is also something that's reassuring for those parents where the kids do get febrile seizures and they're scared and they're worried about what's going to happen. So it's a consideration for that as well. If we take the fever away, though, it's important to know that you may also extend the duration of that illness. So where they may have kicked that out in a couple of days with the help of that fever, we now may be looking at something that's lasting maybe a week or maybe a little bit longer. So just be prepared for that when you're assessing whether or not your management is working, is that it just may lengthen the amount of time before you see that resolution. And that's okay, just be prepared for that or let the parents know that this is pretty typical. Just a few notes of caution with Tylenol. We just want to be careful of giving it to really young kids or given repeated doses. It can be hard on the liver, and ibuprofen can be an increased risk for bleeding for people who have a propensity to that. So just being mindful of the agents you're choosing if you're doing so. So let's talk about fever ranges. So we talked about 100.4 and above is what we call a fever. So if we're in that kind of 100 to 102, we're in that low-grade fever range. In this situation, it's kind of like the immune system's trying to heat up, trying to warm up, trying to burn things up, but it's not quite fully getting that fever on. So we want to think about, what else is going on? Is this somebody who seems like they're sick, they appear sick, they're having a tough time? Do we want to help bring that fever in to use that as a tool? And in that situation, we may consider using warming therapies or warming herbs, things like ginger and warm teas and warm soups and things to try to see if we can't help to bring that fever in. When we get to 102 to 104, this is a great temperature to be. This is an average temperature, but it's a great temperature to be because this is where we know that we are actually going to have an effective fever that's going to help to burn out whatever is in there that we're trying to get rid of. At this point, though, you also want to be mindful that if the immune system has kicked a fever into that range, it's fighting something. So we want to think about what else are we doing as supportive measures to help. Are we making sure that we have other immune support on board? Do we have any antimicrobials on board? Do we have vitamin D on board? What other things are we doing to kind of help support the fact that we can tell the body's working? We don't want the fever to just do it by itself if there's some things that we can do to assist that. And other things to think about are comfort measures. So especially when we're talking about adults, this is a place where we're not feeling well, but kids are in that same boat too. They might have trouble sleeping, they might feel achy, they might be kind of cranky, and we want to think about what are some comfort things that we can do to help them feel a little bit better. Once we go over 104, now we're in a high fever range, and here we definitely are going to feel uncomfortable. This is where we start to have an increased risk for dehydration. The number one issue and concern that we have with fever is dehydration. That is where you're going to get into trouble. So the fever itself is totally fine if you maintain hydration. If you get dehydrated, that's when you can get into trouble. And the younger the person is, the more potential that they have to get into trouble, and big trouble pretty quickly. So in this situation, we want to make sure we're supporting the immune system, and we want to make sure that we're helping find some comfort measures. And we may decide at this point to do something like an ibuprofen or a Tylenol when we can't sleep, right? So if we are so uncomfortable or we are unable to sleep, we need that ability to sleep to help with our healing. Over 106, I've never seen that. I've definitely seen 105s. I've seen 105.5, which was, pretty high, but I've never seen anything up to 106 or above. This is very high, and in that situation, it's pretty rare to see that, but you do want to be taking some additional measures to help bring that down.
Loren? Yeah. I don't really see peds, but where would you do cold sock training?
Yeah, we're going to talk about that.
Oh, sorry.
Yeah, that's fine.
Just clarifying, these are all oral temperatures?
Yeah, we're going to talk about that in just a minute too. So let's talk about measuring temperatures. Okay, so when we measure temperatures, so rectal temperature is the most accurate, but less likely that you're actually going to do that. So forehead temperatures are also found to be accurate as long as you're using a device that's well calibrated and the batteries are up to date. You can always tell at our clinic when the batteries are starting to go because we start getting some funky numbers. Oral and ear temperatures can be accurate if they're done properly. It's really common with an oral thermometer to not have it placed right. to maybe not have it back under the tongue, to, especially in kids, they will kind of push it out, or even in adults, I've seen them grab it with their teeth and not really actually have it in a place where you're getting a good measure. And then we also want to think about, have they just had something to drink that may interfere with the temperature as well. Ear temperatures are also not necessarily accurate. You have to have the signal go across to the tympanic membrane. So depending on if there is a blockage because of cerumen, depending on the angularity, you may not necessarily be able to get an accurate temperature. And the ear temperatures are not going to be accurate in kids under 6 months of age. You can also do a temperature under the arm. These are not as accurate, but sometimes it can be useful as a screening tool depending on what your situation is or the age of the person. And really little people, sometimes that's an easier way to do that, or sometimes to not wake kids up. So here are, based on rectal, forehead, and ear temperatures, oral and under the arm, when it would be classified as a fever. So I just want to go back to, again, hydration. So what's our biggest concern with fever is dehydration. So hydration is the most important thing that you could do. You can actually lower a temperature just with being really well hydrated. A lot of times when people have fevers, they're going to refuse fluids, and so other ways you could get things in are through a bath. A lot of times, especially with kids, they'll like to play in the bath, and also popsicles. Popsicles are also a great vehicle. You can do herbal teas, and you can freeze those and use those as popsicles as well. So again, just hydration, critical. I don't know about you all, but when I was in school, this was like beat into us. Like hydration, dehydration is the most critical thing, especially when it comes to kids, especially when it comes to babies. This is the most important piece.
What did you mean by a bath? Do you mean that they are like drinking some of the water from the bath? Or?
No, they absorb through their skin, and then also the temperature of the water is cooler than their body temperature and can actually help to draw some of that heat. Helps to cool. So some signs of dehydration, and this is also for adults too. So decreased urine output, dark color to the urine. Also sometimes there is a little bit more of a concentrated odor to the urine as well. They can be dry inside their mouth or their tongue, dizzy or weak, especially upon standing. With kids, you'll see that they'll cry and there's just no tears, right? So you've got that kiddo in your office and they are just having a fit. And there are no tears. They open their mouth and their mouth is dry. This is a kiddo that is dehydrated. And so up till 18 months of age, the anterior fontanelle is open, and so you can also notice a depression in the fontanelle with kids who are dehydrated. You can also test the skin for turgor, whether or not that skin bounces back or if it stays up and tented. So those are all ways that you could kind of look to see, are we having signs that you're dehydrated? So with babies, a lot of times we'll just tell parents to just count the number of diapers. How many diapers do they normally have? Or how long has it been? If it's been greater than 8 hours and we haven't had a wet diaper, I'm concerned, right? Because we should have had a wet diaper during that time, especially if we've been taking in fluids. So rest. This is also super important, especially for adult people. We need to be sure that we rest. If we have a fever, our body's working hard and we need to give it a break. And we're probably contagious. Most of the time, if we have a fever, there's usually something going on that's associated, and we're probably contagious. The classic question, parents bring their kids in, can I take them back to school? It's like, well, no, they have a fever, right? So, and schools will kick them out in a heartbeat if they have a fever. So if they have a fever, they're probably contagious. Same with adults as well. Best to be home resting. So some supportive measures. So we talked about that low-grade fever. What we might want to do is actually bring that fever up. But when we get to that kind of mid-range, that 102, 104, this is when we're thinking about doing some additional supportive measures. These are things that are going to help the body, help manage the fever, but not necessarily suppress the fever. So we're working with the body. Here's where hydrotherapy can be really useful. So warming socks treatment, Anybody in here ever use warming socks treatments? Awesome. It is amazing. And parents will look at you like you are crazy. So first what you want to do is let them know that if their feet are cold, if the kiddos' feet are cold, you have to warm them up. So you can soak them in some warm water, soak them in a bath, and warm them up. You're going to take socks, and you're going to get them nice and cold and wring them out. Depending on how cold they are is also going to depend on how vital they are or how brave they are. You're going to go ahead and put those on and warm socks over, and I tell parents to go ahead and bundle them up. This is so helpful. The kids' feet are now cold. They're going to actually draw that heat down and out through their feet. It also helps with head congestion, and it also helps with that achy restlessness. And a lot of times, parents will do this, and kids will just like fall right asleep. And invariably, they'll be like, "Can I do that for me too?" Absolutely. So warming sock treatment is so helpful and so easy to do. We talked about doing a bath. You don't want to put them in a cold bath. I reinforce that. A lot of times people think that, like, oh, I have to put them in a cold bath or dunk them in some ice. No. Too shocking to their system. A normal bath temperature is going to be cooler than what they're actually experiencing in their body. They'll hydrate through the skin, and it'll actually help with reducing some of that temperature. You can also consider adding an infusion of some cooling herbs. So some peppermint, which smells good and is fun, and it's okay if they drink the bath water, but sometimes that also helps with reducing that temperature as well. And acupuncture. So if it's an old enough person for acupuncture, acupuncture can also be really useful for reducing heat. Something that you may come across, and I come across periodically, so culturally there is a historical use of alcohol, either rubbing alcohol or more commonly vodka, to be applied to the back of the neck or to the body or put into the bath to help with lowering the temperature. Alcohol has the potential to be very cooling, and so it cools the skin temperature. So it's not actually bringing that core temperature down, so it can be a little bit misleading. And the other thing you have to remember is that alcohol is absorbed through the skin. So if we are actually applying this to a kiddo or putting them in a bath of it, they're going to absorb that alcohol, which is also a concern for them as well. So just something to be mindful of.
So you do not recommend it?
I do not recommend it, yeah. And I will bring it up even if I haven't heard about it from them. Like I'll just say, you don't want to put alcohol on them, and and I'll just like include it in part of my conversation. And then sometimes parents will ask, why, or, oh, well, but that's what my mom always did when I was a kid, and then we can have a conversation about that.